Hi everyone, I'm Rekha Motoraj. It is 11:55 on this Wednesday. I'm in the KHOU 11 newsroom and we have some breaking news to bring you. We're standing by for a major update from the mayor, rodeo officials, and county officials. They have gathered at City Hall. They're getting ready for a news conference that should be starting in the next 5 minutes or so. We are hearing from several sources that the rodeo will be shutting down amid coronavirus concerns. We don't have details beyond that. We are, of course, waiting to get official word on what exactly will happen, how this big production will be shut down. And we know that there are still a lot of questions, of course, hearing this news. What does this mean for ticket holders? And will you get refunds for concert tickets? What will happen to rodeo scholarships? There are so many questions here, but again, we're waiting to hear from Mayor Turner, Harris County Judge Lena Hidalgo, and rodeo officials to get official word on the rodeo possibly shutting down. Again, that news conference expected to start in the next 5 minutes, so we are standing by to hear more information. In the meantime, we got some new information this morning as well about a Montgomery County patient with a presumptive positive for coronavirus, and this case is not travel related. We're hearing that it is a man in his 40s that has been affected. Again, it is the first case reported in the county, the first in the Houston area that is known to not be travel related. County officials confirmed Wednesday that the man had not traveled out of the state or country recently, and that everyone that he has been in close contact with is in self-quarantine. If this case is confirmed by the CDC, this could be the first community spread case in the area. So we're standing by for more results on that. But the bigger, more pressing issue right now is the production that is the Houston Livestock and Rodeo show that's happening and in full effect, and it looks like it's going to be shut down. That is what several sources have told us, have told KHOU, sources with the city, the county, and the rodeo. But again, we are waiting for official confirmation as we take a look at the rodeo grounds. This is from Air 11. Is this live video we're looking at, Jaime?
Yes, it is.
Okay, so this is live video from Air 11 as we look at that right now. Of course, spring break is coming up. That is obviously a really popular time for the rodeo. So it looks like officials are taking measures now out of an abundance of caution as far as not wanting to spread the coronavirus. So we're going to be hearing more from them in just a few moments. We should also mention the World Health Organization. Officials spoke just moments ago about that. There was a news conference, and the World Health Organization has labeled the coronavirus now a pandemic. So that is a widespread disease. It is prevalent over a whole country or around the world, and now the coronavirus is officially a pandemic. So again, we are standing by as we take a live look from Air 11 over the rodeo. You can see there are a lot of folks out there. People are already out there enjoying the carnival rides and the food and the festivities. And of course, this brings in tens of thousands of people every year. You've got people from all over the country coming in to check this out. Mostly a local crowd, but you've got exhibits from all over the country here and some places from around the world. So there's a lot at stake, and there are a lot of people who attend this, and it sounds like the rodeo wants to shut this down, obviously, for the sake of safety and keeping everyone safe and helping stop the spread of the coronavirus as we see more cases pop up in our area. So again, standing by to hear from officials at City Hall. The mayor is there, rodeo officials are there, county officials are there. We're going to get hopefully more information about how this is all going to work. You can see a lot of people down there at the rodeo enjoying themselves. It's been a really beautiful day, but we're wondering how they're going to shut this down, how people are going to get refunds for tickets that they've purchased. How will the scholarships work? Will people still be awarded scholarships from the money that is raised from this? You know, can you sell your concert tickets? What's going to happen there? So we're trying to figure all of that out. And again, we're not confirming this because, again, even though multiple sources are telling us this, we want to hear it from officials first. So we're standing by for a news conference from officials. We see a lot of you commenting on khou.com. Melody's asking about are our kids are bringing their animals in today? What about the livestock show? So Melody, again, we're trying to get those answers, and hopefully we'll get those answers soon. We know a lot of folks are in your position, and we're hoping that when they make an announcement at noon that they will iron out some of these details as to how all of this is going to work. Shutting down the rodeo is not an easy thing. There are so many people involved, volunteers, vendors, exhibits, so we understand that there is a lot to work through, especially when you have an event that takes a year, if not longer, to plan and lasts for several weeks. So Melody wondering what about the livestock show and how that's going to work. So hopefully we'll have those answers for you in just a few moments. If you're just joining us, 12:01, we are taking a live look at the rodeo from Air 11, as there are reports from officials that the rodeo will be shutting down, and we have not gotten those reports confirmed. We are standing by for a press conference from city and county officials. We are waiting to hear from rodeo officials as to confirm whether the rodeo is indeed shutting down, for how long it will be shut down. Will it be delayed? Will it be moved? Can people get refunds for concert tickets? There's a lot involved, obviously, in the Houston Rodeo. So we're hoping to get all of those details, all of that information coming in the next couple of moments as we stand by to hear from them. So this is a live look at the rodeo, but everyone is gathered at City Hall, and we've been hearing for several hours now that officials want to shut the rodeo down out of an abundance of caution to obviously stop or hinder the spread of the coronavirus in our area. It has officially been deemed a pandemic by the World Health Organization. So, okay, good. We can see those two boxes now. Thanks, Jaime. So we're standing by, obviously, at City Hall. The podium is up. Don't see people walking out just yet, but we know people are gathered there for that press conference. And we are on the left looking at a live pic from Air 11 as we look at the crowds who have gathered here today for the rodeo. They're out there. There's lots of carnival games and rides that people are enjoying today, but it sounds like those hours are limited. And again, we are hearing reports that the rodeo will be shut down. We don't know when it will happen, if it will go into effect immediately, if it will finish out the rest of the day and then be shut down tomorrow. How long will the rodeo be shut down for? Is it possible that all of these events get moved to another time? We've been seeing South by Southwest canceled. Those days of programs, it's over several weekends. And then we talked about, Coachella out in California, the music festival, moving to, instead of 2 weekends in April, moving to 2 weekends in October. So large gatherings, large groups are being discouraged. Folks are listening to that advice. But then you see the folks out at the rodeo who are enjoying themselves. So we're kind of getting looks like okay, no, we're still waiting to hear from officials at City Hall. You guys are following us on Facebook as we stand by for a news conference from officials, and a lot of you have a lot of questions. Of course, people thinking first, will their tickets be refunded, and how will that be handled? And we know that the rodeo could possibly give refunds to those who paid, bought it directly from the rodeo. But of course, if you've paid from other secondary ticket sites, you might not get your money back. And then wondering about the scholarship money. If that was lost, does the rodeo maybe have insurance for something like this to cover those scholarships that are promised to students? We know that hundreds of vendors come out here from all over the country. You know, they pay to rent space at the rodeo. They're wondering if they will be refunded. A lot of them are not local. You know, like I said, they come from around the country, so there's travel expenses that are associated with that. So that is something to keep in mind. And we should also mention that the carnival part, you know, that we've been watching through Air 11, that area, a separate company actually runs that. So we're wondering if they are also going to shut down, if the rest of the rodeo shuts down. So that's kind of all part of it. So many questions there. You know, for a lot of people who come to the rodeo as competitors, who are part of the show, you know, for them this is their livelihood, and oftentimes they, you know, pay for their own entry fees and other expenses just to be a part of it. So are they out of money as well? So many questions about this. Wondering if the rodeo has a contingency plan for anything like this. Wondering if they have insurance to cover the cost from this, because shutting down the rodeo will cost tens of thousands of dollars, hundreds of thousands of dollars, if not millions. So all of these things are questions that folks have, and we're hoping to get them answered soon. On the right-hand side, it's a live pic of City Hall as we wait for city officials, county rodeo officials to talk to us. We have reporters gathered there as we wait for official information about the rodeo possibly shutting down.
Can I get you to change this to the press conference? Do you need to maybe downgrade your pre-workout? Yeah, 6. Thank you. Yeah, make sure it's turned down. Yeah, I'll turn it up. Thank you. 3. Yeah, no, I got it.
A lot of people, of course, waiting to hear from officials, so are we. So on the right, we're taking a live look at City Hall. On the left, from Air 11, a live look at the rodeo right now. We see plenty of people there, you know, enjoying their time at the rodeo, which is expected to be shut down. We're waiting for officials to give us the word and kind of iron out and lay out the details as to how everything is going to work. But on KHOU.com, we have a timeline of all of the developments that have happened in the Houston area and around the world in regards to coronavirus. The latest update as of 10:30 from the Associated Press, talking to Major League Baseball saying that if a team is unable to play in front of fans at a team's home ballpark because of the coronavirus outbreak, the sport's first preference likely would be to shift games to the visiting team's stadium if possible. Now, baseball's preference is to play in front of fans and not in empty stadiums, but will rely on local officials to make the call in each city. Of course, this is a concern because opening day is March 26th. Montgomery County, or Montgomery ISD, I should say, will be closed early for spring break. It is closing down for a deep cleaning. Of course, this is out of a, quote, abundance of caution. So no classes tomorrow or Friday, starting spring break a little early. And of course, next week is spring break. Classes are set to resume on March 23rd. That is for Montgomery ISD. Also in Montgomery County, as we reported yesterday, there is a man in his 40s who is the first presumptive positive novel coronavirus case there. And health officials are saying he has not traveled recently. Everyone around him who's had close contact with him is in self-quarantine. If the virus case is confirmed by the CDC, though, this case in Montgomery County could be the first community spread case in that area. So authorities are also monitoring that situation as well. As we take a look again at the two cameras we have up right now, again on your right is City Hall here in Houston. On the left, the rodeo.
For those of you who are live streaming or have obviously your television stations, we are going to have a sign language interpreter.
Please. I may hear something. Hold on.
So right now, I'm already off my. Do I know?
Okay, my mic's on. All right, we just heard a quick update from Mary Benton with the mayor's office saying that officials will be coming out soon to give us a very important update that the mayor and we understand Harris County Judge Lena Hidalgo are still conferencing, still trying to iron out some details before they come out and speak to reporters. Again, we are standing by for this update about the Houston Livestock Show and Rodeo, and we've heard from several sources both with the city and with the rodeo and with the county that the rodeo will be shutting down. Again, the mayor, rodeo officials, county officials are gathered at City Hall. That is the picture you see on the right. We are standing by for a news conference, hoping to get more details. When will the rodeo be shut down? How long will it be shut down for? Will it get moved to another month? So many of you have questions as well about how all of this is going to work. Will tickets be refunded? What's going to happen with the scholarship money that is lost? Is the rodeo insured for something like this? What about all the vendors? You know, we have hundreds of vendors that come out, not just from locally in the Houston area or in Texas, but people from across the country come out to the Houston Livestock Show and Rodeo. They pay the rodeo to rent space. Are they going to be refunded? Are they going to be given back money for travel expenses? So that is a question a lot of people have. And of course, the competitors who come here, for them, this is their livelihood. A lot of them pay their own entry fees and the other expenses that are associated with competing in the rodeo. So what does this mean for them? We are waiting to get answers to all of those questions, hopefully in the next few moments from City Hall. But in the meantime, if you look on the left at the picture, that is a live look from Air 11 at the rodeo, and folks are out there enjoying the carnival, the rides, the games. So we certainly have pretty decent attendance, as we've seen when the rodeo first opened up last week. But that could all be shut down. We just don't know how soon it could be shut down, but we are hearing reports from several sources that the rodeo will be shut down out of an abundance of caution for the coronavirus and those concerns. We're standing by for a live update on all of that. And this, of course, coming just as the World Health Organization has determined that the coronavirus is officially a pandemic. And as we know, several countries around the world are dealing with large-scale outbreaks. Here we have just a little more than a dozen cases, but we are following things closely. And of course, the rodeo doesn't want to contribute to that problem. So we're guessing that is why they want to shut down, obviously, to keep everyone safe and healthy. So again, waiting to hear more information. All of this coming before spring break for a lot of schools. So it's sad, for a lot of folks, spring break is a time that you head out to the rodeo, especially with your kids, and attendance is typically up during those weeks. But that looks like that is not going to be the case this year because of coronavirus concerns. Hi everyone, this is Reka Mutaraj in the KHOU 11 newsroom, and we're coming up on 12:30 right now, still standing by for a press conference with city officials, county officials, rodeo officials about this news that we're hearing that the Houston Livestock Show and Rodeo is shutting down. We've been, just want to tell folks who we see you commenting on Facebook wondering why the audio is cutting in and out. We just want to give you a little bit of information, and then we're kind of cutting out to gather our facts again, and then we'll get back on air. So don't worry, the audio is working well. And of course, as soon as that news conference starts, we're going to bring it to you live, and you'll be able to hear everything that officials are saying about this. But again, we're cutting in and out with audio just to, as we, like I said, gather facts, get some more details, and then we come to you as soon as we get them and relay that information to you. But really just, unprecedented news that we are waiting for folks to confirm as we take a live look at the carnival area at the rodeo, usually a place that is packed during the 3-4 weeks that the rodeo is open. It looks like Air 11 cutting out for just a second there. All right, we're back. And especially over spring break, we know that so many of you have plans to go out there with your families, your kids, and enjoy the rodeo as you do every year. But we have been told from several sources that the rodeo will be shutting down out of an abundance of caution over coronavirus fears and not wanting to spread COVID-19 further. Those concerns obviously will be something that officials talk about in the next few moments. We were told initially the news conference would be happening at noon. It is now coming up on 12:30, and we're still waiting to hear from them. On the right-hand side, that box is a live look at City Hall, where we're hoping to hear from the mayor anytime soon. We know that Mary Benton from the mayor's office, his press secretary, came out and said that he and Harris County Judge Lena Hidalgo are still talking and working out some details. So it might be a few more minutes before we hear from officials. But again, these are new breaking developments that we're hearing right now.
Yes, so we just saw a tweet from from Mayor Turner, and he says that he and the county judge are briefing the region's stakeholders. So we should begin to this press conference shortly after they're done with that conference.
Awesome. Okay. And that is Jaime. He is helping me with this webcast. He's running things behind the computer. Thank you, Jaime, for that update from the mayor. So he said a few minutes?
Yes.
Okay. All right. So we're still waiting to hear from officials, and hopefully they can answer these questions that we have. We know that you have so many questions. I'm seeing them as I scroll through the Facebook comments here. We know a lot of you are watching. Really, the big question is a lot of people are asking, am I going to get a refund for my tickets? I know a lot of you guys have concert tickets. You were looking forward to seeing artists come through here. A big one was Lizzo. That was a big draw for a lot of you. But a lot of you wondering if the rodeo will refund you for those tickets. A big part of this, obviously, because it's the rodeo and it's the reason we do this, but the scholarship money that is supposed to be awarded to so many students in all of this. People wondering, is the rodeo insured? Can they handle something like this? So that is a big deal. We're also wondering about the vendors. You guys get super excited about that. Okay, it looks like officials walking out at City Hall. They're coming out to the podium. There's Mayor Sylvester Turner, Harris County Judge Lena Hidalgo. Let's listen in.
Let me say good afternoon. And I'm standing with County Judge Lena Hidalgo, Dr. Shaw, who's also from the county, Dr. Purse, the City of Houston Chief Medical Officer, Chief Pena, Chief Acevedo, a number of department heads, Officer Chief Pena, Chief Acevedo, a number of department heads, Susan Christian over special events, And then a number of our city council members, Vice Mayor Pro Tem Martha Castleck Tatum, Councilmember Robert Gallegos, Councilmember Tiffany Thomas, Councilmember Amy Pack, Councilmember Abby Kamen, Councilmember David Robertson, and Councilmember Carolyn Evans Shabazz. And then I think I mentioned Joel Cowley from the Houston Livestock Show and Rodeo, a representative from Congresswoman Sheila Jackson Lee, and other persons. Let me just say the reason why we are here today is, of course, it's the coronavirus, and to kind of bring people up to date as to where we are as of today. And up until yesterday, all of the cases that have been confirmed in Fort Bend, Harris County, City of Houston, all of those cases had been related to international travel. And all of them, with the exception of one that traveled to Italy and came back, were directly tied to that Egyptian cruise line. And that was up until yesterday. And then, of course, on yesterday, we had the case that was confirmed in Montgomery County that was not tied to international travel, and appeared to be a situation that was took place within our region. And when I say Montgomery County, I count that within our region: Fort Bend, Harris County, Houston. And that changed things. And as a result of that, we said that we would monitor this situation very, very carefully, and that we would make the necessary adjustments as we went along to make sure that we were doing everything that we needed to do to keep people safe, based upon the facts, the science, and the medical advice that we were being given. And so yesterday changed things. Because yesterday, with the case in Montgomery County, that was evidence of some community spread. And as a result, that takes us to what do we do next? I will tell you by the end of today, I will be signing an emergency health declaration for the city of Houston. And I'll also, Judge Hidalgo can speak to what the county will be doing, but we're both on the same page. And so at the end of the day, I will be signing an emergency health declaration, and which will remain in place for 7 days as we continue to assess the situation. And then depending on where we are at the end of that 7 days, then City Council will have to vote to continue that emergency health declaration. But that will take effect as of the end of the day today. What does that mean? That means, as it relates, for example, to the Houston Livestock Show and Rodeo, that we deeply love and support. They are impacted and directly impacted by the decision and the changing of events. And I will tell you, it's not an easy that has come to easily, but after conferring and talking with the stakeholders, and we all have the utmost respect and love for the Houston Livestock Show and Rodeo. We are all in agreement. It is a decision that is being made in the best interest of the health and safety of people within our region. And so as of today, starting tonight, the concerts will come to an end as they will phase down. And it will also impact the remaining concerts and events at the Houston Livestock Show and Rodeo. And let me just add, that is not the only event that will be impacted. As you all know, this coming week is the Tour de Houston. And the Tour de Houston will also be rescheduled. And if we cannot reschedule it, it will be canceled for this year. And Susan Christian of a special event, and I know their teams, have been working very, very hard. But that event will also be either rescheduled or canceled. And for the event in the month of March, as it relates to the city of Houston, those events that are produced, co-sponsored, and permitted, those events will be impacted as well for the duration for the month of March. And so that would include, for example, our capital improvement program town hall meetings as of tonight. Scheduled for tonight, scheduled for tomorrow. Those meetings will be rescheduled for the months of April and May. And so all of the events for us that are city produced, co-sponsored, and permitted for the month of March are going to be either rescheduled or canceled. And let me tell you why. Again, changing circumstances, and I've said from the very, very beginning that when we are confronted with the facts, medical advice, counseling, the science, that we would not hesitate to act. And I will tell you, for those of us who are Texans through and through, and from our area, from our region, you know just how much we love in the Houston Livestock Show Rodeo. So you know that this decision has not come easily, but the health and safety of the people in our region is paramount. And it is important for people to know that based upon the facts presented, we'll make the necessary decisions to keep everyone safe. And that's what we will do. And so we'll carefully monitor this situation. And I am saying for the month of March for the city of Houston. And then the county judge and I are going to huddle a little bit later on today. And we will sit down and coordinate responses and steps that we need to take as we move forward. I want to thank the county judge for her collaboration and the partnership. The county has just been an incredible partner, and I want her to know, and I want to say it publicly, appreciate the support and the leadership that she has provided along with her entire team. And with respect to my team, Dr. Purrs, Stevens Williams, and his Dr. McNeese, the entire health department, I certainly want to thank them. But I do want to really appreciate Joe Cowley and the entire Houston Livestock Show and Rodeo team for their support and their cooperation. Now let me pause and let me bring up Dr. Purse, then followed by County Judge Lena Hidalgo. Dr. Purse.
Thank you, Judge, and thank you, Mayor, and thank you, Judge, for being here. I just want to remind everyone why we're doing this. This virus is new to the human population. None of us have any immunity to it. We don't know how wide it's going to spread. We're watching around the globe, and we're seeing many communities, many nations coming up with many, many cases, and the spread is occurring very rapidly. Within that spread of the people who get ill, we do know that about 80% of those folks have minimal or mild symptoms. To some degree, that's a bit of a problem because those folks are probably the ones who are spreading it throughout the rest of the community. There is a subset of the population, about 15% of the population, who requires hospitalization. There's another percent of the population who's requiring intensive care level care, and they're on critical condition, and we're seeing waivers, the number of waivers, but we're seeing about a 2% death rate from this. So the death rate appears to be predominantly in people over the age of 50. That seems to be the highest percentage. But depending on which decade of life, 50 to 60, 60 to 70, 70 to 80 or above, it's 5, 8, 10, as much as 15%. We're doing this in order to save lives. This is a very big step that the mayor and the judge are taking, but it is to save lives. If we are successful with not only the things that this community can do, what government can do, but what you can do in terms of social distancing, washing your hands, covering your cough, not going to work when ill, those things, when we do those together, we can slow down the spread of the virus through our community. And it's important that everyone understand that that is what did not happen in Wuhan. It exploded in Wuhan. They didn't know it was coming. They had no warning. They had no time to prepare. They had no ability to slow it down. And it completely overwhelmed the community and, importantly, their healthcare system to the point when people needed a hospital bed, there was none available. What we are trying to do with these very aggressive and, yes, painful decisions is to slow down the virus, because we have every reason to expect that at this point, hopefully I'm wrong, but we have every reason to expect that it can spread to many, many people in our community. With 80% of the folks having minimal or mild illness, if that happens over a long period of time, we'll be able to handle that. But for those percent of folks who need a hospital bed, there needs to be a hospital bed available to them. So if everybody gets sick at the same time, we won't have a hospital bed available. And afterwards, we have a graph over here to the right, a chart that you can look at. We can talk about it later that kind of shows that in a graphic form. But I want to remind everyone that everybody up here understands how difficult these decisions are, how painful it's going to be to some folks. But we're doing it in order to save lives of real people. And if we are successful, we will look back on this and say, well, you know what, it turned out not to be such a bad deal. Well, if that's the case, and we're seeing what's happening in Italy, for example, then that will be because of all these things that we have done. It won't be because those things were unnecessary. It will be because of the steps that we're taking, like the steps we're taking today. And the option is to not do these things, in which case we would certainly expect to have a Wuhan situation. That is not acceptable. So as painful as these things are, I want to remind everybody, we're doing this in order to save lives. Thank you.
County Judge.
Thank you so much, Dr. Peirce. Thank you, Mayor, and to all the council members here, the department heads, everyone for your collaboration. It truly is a regional effort. I was on the phone with Montgomery County just before this. We've been in very close contact with Fort Bend County, and we all recognize that this virus does not respect political boundaries. So we're working very, very closely together. I know that the anxiety in the community just continues to grow as we hear the news of spread in other areas of the country, areas of the world, and of course, news that the rodeo will be canceled will only add to that. And so I want to acknowledge the concern that we all feel given the the fact that we're still trying to understand this virus and that ultimately it's a health issue. And so first, of course, the rodeo will be canceled. They'll begin winding down starting today. And as the mayor mentioned, we will be working together to assess what other steps need to be taken. I will also be issuing later today a disaster declaration for Harris County. Yesterday at Commissioner's Court, we directed all our departments to prioritize coronavirus preparedness over and above anything that is not an essential function. And we are working very hard with all of the hospitals, with businesses, with schools, as we have been, to ensure that we not only have plans, but that we've exercised those plans, that we've identified weaknesses, and that we're preparing for whatever will happen or may happen with the virus. I do want to make clear, for some time, and especially this weekend, it became very evident that we are facing limitations as to our testing capability. And I've mentioned this somewhat. There are folks that we had to wait for state approval on for that test to be able to be sent to the city lab or to be sent to the lab in Atlanta. And so there are many more folks we could have tested, but because of the lack of tests we've received from the federal government, we've had very limited capabilities. Over the last couple of days, it's become clear that that may have give us, in a sense, an undercount, if we want to put it that way, of what the community spread may have been. And so we were already working toward the step that we're taking today with the rodeo, and we were already working toward further steps. The positive case was identified in Montgomery County, but we know that that individual may have had contacts throughout Harris County. We know that it is only possible and very likely that there are other cases like that going on in Harris County And so I want folks to know that we'll be working hard to continue to be proactive, understanding that if we had the capability to test more people, we surely would be having more positives and perhaps more evidence of community transmission. And so at the county, we'll also be evaluating our county-sponsored events, but most importantly, hand in hand with the mayor and other jurisdictions, what other steps we need to take right now. Very important for folks to recognize. We are not a hermetically sealed community. We can't do that. We are not an island nation. We can't close our borders. We can't do what some of these small countries have been able to do just here as a county or as a city or as a region. And so we have to recognize that it's possible that despite our containment efforts, it's possible, if not likely, that we will see wider spread of this virus. And so that's where what Dr. Peirce said is very important. This disease, 80% of the people who get it have mild symptoms, like a mild flu. That 20% are the people who are going to need to be able to access our hospitals, the 20% that see themselves more affected, the small percentage that may be at risk of dying from this disease. And so we all have to begin putting into perspective right now what those statistics are, because as much as we're working with the hospitals to ensure that they have the areas cordoned off, that we have the hotlines for folks to call who don't have health insurance, the hotlines folks can call who are undocumented, ultimately we're all going to have to continue to play our part, not only on social distancing, not only on staying home if we're sick, not only on washing our hands and not coughing into our hands, but also in ensuring that we are not, flooding the hospitals or the doctors unnecessarily, those of us who know we are at low risk of being affected significantly by this virus. And so I want to make sure folks know we are working in coordination. The rodeo is being canceled. We are discussing any other options, any other steps we need to take right now, but containment will not be foolproof. It can't be, given the nature of our community. We are doing and will continue to do the best we can for that, but we are also very much focused on what our role is and will be in the event that this becomes more widespread, not just us, but everyone else in the community. I know a lot of folks had plans for the rodeo, perhaps for the tour, for some of these events that are going to be affected, but we all need to do our part. We need to stay informed, stay calm, and recognize that this is a community-wide response that we can't just do as government. En español, repito. Nos hemos reunido por el hecho del coronavirus. Sé que hemos todos visto pues la continuación de la comunicación de este virus en otras ciudades, en otros países. Eso causa mucha ansiedad. Definitivamente el anuncio de hoy, que el rodeo se verá cancelado, también va a preocupar más a la gente, y eso se entiende, es de entender, es una enfermedad, nos preocupa a todos. Estamos tomando nosotros medidas muy claras para manejar la situación. Primero, obviamente, cancelar el rodeo. Yo también, así como lo está haciendo el alcalde de Houston, yo también estaré declarando un desastre en el condado Harris el día de hoy, más tarde, lo cual nos permitirá tomar pasos adicionales al contener esta enfermedad. También estamos evaluando y estaremos evaluando con el alcalde a través del día de hoy qué otros pasos debemos tomar para intentar contener el virus. La realidad es que hemos sabido ya el último día o 2 días, nos hemos dado cuenta que la falta de pruebas aquí en el condado, en el país realmente, han hecho que no tengamos una cuenta clara de cuántas personas han sido afectadas. Hay pruebas que nos gustaría llevar a cabo, pero tenemos que pedirle permiso al Estado que nos permitan siquiera enviar la prueba al laboratorio de la ciudad, enviar la prueba al laboratorio de Atlanta. Entonces, por esto de que el gobierno federal no nos ha ofrecido suficientes pruebas, debemos asumir que realmente es más gente la que está afectada de la que estamos midiendo el día de hoy. Entonces es por eso que estamos tomando esta precaución. Realmente lo habríamos tomado el día de hoy, aunque no hubiéramos recibido la información de este caso en el condado de Montgomery. Y estamos evaluando cuáles otros pasos hay que tomar. Estoy trabajando muy de cerca con el alcalde, también con los jueces del condado en Montgomery, en Fort Bend y en otras áreas, todos muy de cerca reconociendo que no respeta el virus estas fronteras políticas. Algo que quiero que la comunidad entienda y escuche muy claramente. Y esto es que no somos una isla, no somos un país que puede sellar sus fronteras, ni el condado ni la ciudad podemos aislarnos de esa manera. Entonces, no podemos tomar medidas 100% que vayan a completamente, pues, prevenir el contagio de este virus. Tenemos que aceptar que es posible, tal vez muy posible, que vaya a haber contagio mayor a través de la comunidad y en preparación para eso, prepararnos como condado, como ciudad, como región, qué hacer para continuar el gobierno, para continuar las funciones necesarias. Para los residentes, debemos todos entender, ver la ciencia y saber que el 80% de los casos de las personas afectadas se ven afectadas como una gripe menor, nada más que eso. El 20% de las personas afectadas, personas mayores, personas ya con cuestiones de salud, esas personas están a más alto riesgo. Entonces son aquellas personas, ese 20%, debemos dejar los hospitales abiertos para ellas. No debe haber pánico entre el resto de la población. Desde ya tenemos que entender el riesgo del virus y la realidad que es simplemente el 20% de las personas afectadas y entre esas un porcentaje muy pequeño que se ve riesgo de fallecer dado a este virus. Entonces, por ahora, seguir todos con esta sociedad entre el gobierno y la comunidad de lavarnos las manos, de aislarnos. Si se ven enfermos, por favor, no vayan a la escuela, no vayan al trabajo, porque no saben qué pueden tener. Mejor no asumir. Y también ayudarnos a empezar a pensar en esto. Si se volviera más común el virus, no va a haber pánico, vamos a entender que la mayoría de nosotros no sufre mayor riesgo. Entonces, pues agradecerle a la ciudad, a los concejales, al alcalde y a todos saber que estamos trabajando muy de cerca para intentar ver cuál es la siguiente fase de esta situación y cómo nos podemos preparar para eso. Thank you so much.
Thank you. Dr. Shaw.
Thank you, Judge. Thank you, Mayor, for having me here. I wanted to, first of all, my name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health and the Local Health Authority for Harris County. And I want to just add to what the Mayor and the Judge have said, as well as Dr. Peirce. It is important to remember that we have been talking about novel coronavirus from a standpoint of both monitoring and response, from the standpoint of if to when to now. And I think that is the important piece of this that is really about what's happening in our community. Dr. Peirce has laid out all of the different activities that the two health departments have been working on. Dr. Peirce and I, Stephen Williams, the City of Houston Health Department Director, have been connected, and it's not just the two health departments being connected, but our regional public health partners have been connected over the last few months to really understand what has been happening globally, what's been happening now domestically, and now what's happening here locally. So we know that these decisions and these activities that everybody has planned for are difficult decisions for us to make, but also for people in the community to partake in changing plans and making all those other aspects of what potentially could disrupt what their activities have been planned for or scheduled for. But we also recognize at the end of the day, the number one priority for all of us is to protect our community. The health and well-being, the safety and security of our community. And that's why we have moved forward with this step. And I do want to say that there absolutely important is that change with the Montgomery County situation, that has really been a significant change. We know there is a lot of evolving information here, and we also know that on a global standpoint, the World Health Organization, WHO, just within the hour has now declared COVID-19 a pandemic. And so that really highlights how seriously entities, decision makers, and responders are taking COVID-19 across the globe. And I think it's very important for us to continue to emphasize what we've been emphasizing throughout, which is one, that we want people to take all the precautions that they can, especially, as the mayor mentioned, those who are elderly, those who have chronic health conditions. We want to make sure that you limit your interaction with those who may be sick or those who you are concerned about. We also want to make sure that if you are sick, that you don't go into settings, whether it's at work or sending your child to school, that you do not get others sick in our community. And when we say community, Judge Hidalgo and Mayor Turner absolutely are correct in that it is not just Houston, Harris County. It is our community at large, our entire region. We know people move around. We know people work in one place and live somewhere else. We want to make sure that you're taking all the precautions, not just for yourself and your family, but for your neighbors, for your elders nearby, for the people that are really most at risk. We want you to take all the precautions to help them stay healthy, safe, and protected. And finally, we're also saying make sure you remember all those personal hygiene and personal protective measures that we've been talking about, everything from the assurance of hand washing and certainly using hand sanitizer when not able to use soap and water, which again, as a reminder, is the #1 way to fight against a variety of respiratory conditions and infectious disease conditions is not hand sanitizer, it's actually soap and water. So I know there are a lot of concerns out there about the hand sanitizer, but soap and water. And then the other piece is certainly cover your cough, and there are a variety of both information that we've been giving out there. And I think it's important for us to remember that it's not if and when, it's now. The final thing I want to say is that both health departments have set up hotlines for information. There's information that's available at Harris County Public Health. There's information at the Houston Health Department. We've also stood up a information line with our Harris Health partner that's also information for clinical questions that may be coming up from the public. So between those, or amongst those three local resources, we're also pushing everything we can to assure that information is out there through our websites. You can go to readyharris.org, as well as the websites for the city and the county, as well as obviously the state and other federal partners. It is absolutely important that we give ourselves all of the information so we can make good decisions for ourselves and our family. Thank you.
Joel Connolly, President of Houston Livestock Show and Rodeo. Joel.
Thank you, Mr. Mayor. First and foremost, I want to thank the city and the county for their professionalism over the past week. And I also want to recognize Dr. Kelly Larkin, one of our volunteer vice presidents, for her efforts in making sure that we took every possible precaution on the grounds during the first week of the Houston Livestock Show and Rodeo. So we have been in constant communication with the city and county health departments over the past week and really operating under their guidance. With the evidence of community spread, obviously things have changed, and we will respectfully and dutifully comply with the order to cease our operations. As heartbreaking as this is for our millions of fans, our 35,000 volunteers, our staff, our exhibitors, and our contestants, it is the right thing to do in the interest of the health and well-being of the community. And so we have implemented procedures to do an orderly wind down of our operations. There, as the mayor earlier stated, there will be no rodeo and no concert this evening, nor for the remainder of the show. We do have some livestock and some horse shows going on, and we will wind those down today as well. With regard to those who are on our grounds presently, we are requiring that they depart the grounds by 4 p.m. And for those who are holding pre-purchased items, whether those be tickets or whether those be carnival packs, we will be posting refund information on our website. So please be patient with us as we get that information out. One of the other questions that I've received is, does this mean we will not be giving scholarships? And I am happy to tell you that due to the foresight of our executive committee, we are in a position to fulfill our annual contribution and commitment to youth and education. And so we thank the city and the county for their support in this. As hard as this is to do, it is the right thing to do. And we definitely thank the community for the support of the Houston Livestock Show and Rodeo as well. Thank you.
Thank you, Joel. I do want to recognize Jay Carrero with Senator Cornyn's office as well. Thank you, Jay, for being here. And let me just say in closing, the Houston Livestock Show and Rodeo has been and continues to be an incredible partner and asset to our region. It goes far beyond Houston, Harris County, Fort Bend, Montgomery County, you name it, an incredible asset, resource. And so let me thank the Houston Livestock Show and Rodeo, and they took just additional steps to prepare to keep everyone safe, and so that's very much appreciated. Let me also say, what does an emergency health declaration means? So when it comes to, it will give us greater abilities to manage our resources, flexibility with the procurement process, in acquiring assets, and hopefully in getting federal assistance as well. And those are the primary reasons for the emergency health declaration. I want that to be clear because I don't want everybody to think that we need to get in a panic situation. So let me just tell you why we are doing it. From a contractual point of view, procurement point of view, managing resources, getting federal assistance, those things are important. And so that's the purpose, that's the reason why we are putting forth this emergency health declaration, both the city and the county, by the end of the day. Another thing that I want to bear in mind is that we're working collaboratively. And so the month of March, let me speak from the city's vantage point, from the month of March, we have school districts that are already out on spring break, like right now. We have big school districts like Houston Independent School Districts that I think will be out on spring break, like next week. Okay, and you have University of Houston, I believe that's out right now. Rice is out this week as well as next week. So they're out right now. And so by canceling or rescheduling a lot of these activities right now in the month of March, it kind of helps to contain and mitigate. Because now with the rodeo not taking place right now in this time period, with Tour de Houston not taking place, with the city, for example, rescheduling and canceling events right here in the month of March, the goal is to do everything that we can within reason to contain and mitigate. That's the goal right here in the month of March. And so even though there are only 2 confirmed cases in the city of Houston, we are regional, and people travel from one part to the other. And we are totally incorporated within Harris County, and Harris County covers a large area. And people in Montgomery, Fort Bend, we all go back and forth. And so the goal is, if we can significantly slow things down, and for people to, while we assess what's out there, because we really don't know what's out there, but it does provide for people who are traveling internationally. For example, if they're coming back, 14 days self-quarantine. That's what we're saying. We're saying that people stay away if you travel internationally from nursing homes or senior living facilities. We're saying that. For those who are elderly with underlying medical conditions, we're saying stay away from large crowds. So those messages we continue to say. But again, I do want to emphasize, this is not a time for people to panic. Okay, or be fearful, you know. Yes, you can go to the store and buy the soap and buy the sanitizer. And quite frankly, as I've said before, I never go home without it, leave home without it. You can do that. But purchasing the toilet paper, I don't get that one. That one I don't get. So let me just say, we said we will make decisions based on the facts, the science, and the medical advice. No medical physician, doctor, anyone has said anything about, for example, the toilet paper. Okay? So I want to say that, and then I want people to understand the decisions that we have made for today, even as it relates to the Houston Livestock and Rodeo, was not just made in a vacuum by the county judge or the county or the city. We have had these conversations with the Texas Medical Center. We've had these conversations with almost all the CEOs, the hospitals in the Texas Medical Center. And I can rightfully say to you, we are all on the same page. Because the number one concern is to do everything we can to maintain the health and safety of the people in our region. And we said we would watch this situation very, very carefully. And as the facts change, our strategies would have to change to correspond to those facts. And the situation is still fluid. But the goal in the city of Houston and in the county and in the surrounding region is to recognize when conditions change and then to do everything we can to be proactive, to contain, and to mitigate. And if we do that collectively, then we will come out of this situation and we'll move forward, okay? So with City of Houston employees, I still expect for you to show up tomorrow, and I still expect for you to work the entire day. In fact, I expect you to work the entire day today, okay? So we're going to continue to go about our business. We're just going to do it in a very smart way, and that's the goal. Having said that, we'll take any questions that anyone may have.
Mayor and Joe, can you address the fact that my sources tell me that this individual in Montgomery County attended the rodeo, and that is part of the reason why you guys took such immediate action today, and that he was actually there for certain days?
Dr. Percy, you want to take that?
The action being taken is because of community spread. And as the mayor pointed out, and as we all know, we move all over the community. And so this individual became infected. We don't know how, which means there is likely another person in the community. And so we suspect that this is, potentially a tip of an iceberg, and there may be many people throughout the community who are infected. So that's why we're taking these steps at this point. And as the mayor pointed out, this is an issue of large gatherings that we're talking about. So the bike tour and other large gatherings, all the things that the city, as he pointed out, are sponsored, permitted, I can't remember what the exact phrase was, but those are all being, because we know that the virus is no longer, when it was related to that Egyptian cruise, we knew who those folks were, we knew who their close contacts were, and we felt we had it contained at that point. But we all knew that it was probably a matter of time before this was going to happen. So now that this has happened and we have community spread, this isn't about the rodeo, this is about large gatherings and protecting the community.
I understand, but if he was at the rodeo at a specific barbecue tent or at a specific incident, wouldn't those people who attended the tickets for those tents, who work security, who are volunteers, want to know? And are you letting those people know?
So,
that question
yeah.
is not being answered. And
So,
especially if he went to a concert, a specific concert.
It was not.
well, okay.
Let's be, because I hear your question, let me be straightforward. There is some indication that he was at the barbecue cook-off. Right, he was at the barbecue cook-off, and then we are tracing to specifically find out where he was, okay? But not at the concert. He didn't attend any of the concerts and anything of that nature. But there is information that he worked or was at the barbecue cook-off, and then we are trying to trace back. That I'm trying to get information on.
So one thing to add, and I appreciate that question, is obviously the teams, the epidemiological teams have to go and do their investigation. And so they're still honing in on exactly the contacts of this individual. Obviously, people's recollection is murky. If we thought about what we did a week ago, it's hard. And so they're trying to trace this gentleman's steps, and based on that, we'll put out additional guidance if we get something concrete. Our best understanding right now is he was at the barbecue cook-off on the 28th, and they're still trying to suss out whether he had symptoms then, which would have made it a bigger issue, or whether he didn't have symptoms, which wouldn't have made it as big an issue. And so that's why right now we're asking everybody, if you're feeling sick with symptoms that could be related to coronavirus, please don't go to work, don't go to school. If anyone has unexplained, symptoms and have a sense that they may have this, they can contact your healthcare provider. Don't show up, because if you do have it, you're gonna end up, passing it on to everybody else. Call your doctor. If you don't have a doctor, call our health lines. The city has one, the county has one. We're working with the state to try to have the same number. They're not there yet, so we're doing it right now. We have to have our separate lines, but we're cross-referencing to one another. Fort Bend has one too, and no matter if you have insurance, if you're undocumented, you can call our line if you think that you may have this. And so, but Maya, to answer your question, the decision was made because of community spread, and it's already something that we were thinking about given the undercount or the lack of testing capability. En español. Sí, espérese, Sí, entonces en este momento todavía estamos estudiando bien cuáles fueron los contactos de esta persona, de este señor, y obviamente le queda difícil a él recordar exactamente qué hizo. Entonces, por eso estamos haciendo la investigación. Lo que sabemos por ahora es que él atendió el concurso de carne asada el 28 de febrero. No sabemos si tenía síntomas o no, de eso depende si estaba en modo contagioso o no. Entonces, esa es la investigación que se continúa haciendo. La decisión de cerrar el rodeo hoy se hizo base a la transmisión en la comunidad, no necesariamente que él haya ido a esta competencia barbecue, la cual igual sucede antes de que comience pues todos los eventos del rodeo. Pero pues por eso se le está pidiendo a todos que por favor, si están enfermos, no van a trabajar, no vayan a estudiar. Si no tienen seguro médico, si no tienen papeles, pueden llamar a las líneas del condado o de la ciudad. Si sí tienen doctor, por favor llamen a su doctor, no vayan. Porque si están enfermos y van a la sala de emergencias, van al médico, pueden enfermar a la demás gente. Yeah.
Yes, sir. I learned, I got information on it last night, somewhere around between 8:30 and 9 p.m.
There's some NCAA tournament games scheduled for March 27th, the weekend. Are those going to be held or canceled?
That I cannot speak to. I can't speak to that at this time. What I will indicate to you with respect to city-sponsored and co-sponsored and permitting and events controlled by the city for the month of March, we are canceling those. We'll continue to work with all of the other stakeholders in the city. At this point, we are continuing to assess our situation, but what I can definitively tell you with respect to city-sponsored, permitted, and controlled events, those events are being rescheduled or canceled for the month of March. And then we'll continue to work with the other partners and the other stakeholders in the city.
HIC's in class until Friday, 200,000 kids and their families. What is your, and the district has not told us much, they have a couple of teachers in quarantine, so somebody went to Italy or something, but what recommendations have you guys given to the school district, about what to do? Should we have class until Friday? Do they want to make spring break 2 weeks? Things like that.
We'll certainly leave it up to them, but if they want to continue out the rest of the week and then they'll be on spring break next week, I think that would be consistent.
If I might add, Mayor, so with all of the school districts, the communication has very much been, and we're talking to all of them, if you see a child who is sick, make sure that they're not there. And so that's been a continuous communication. We've been asking them to plan for, what it would look like to continue operations, or what would happen if this becomes more widespread. As we discussed earlier, we will be talking more later today, given these developments. Obviously, I was at Commissioner's Court all day yesterday. Mayor was at Council all morning. And so we're going to talk about every other steps that we can take and should take, and we'll be making additional recommendations based on that. But right now, we just got news of this community spread. We've just now seen our testing capability limitations, and we're taking the steps as quickly as we can. We wanted to make sure and get this out today so the rodeo could shut down today and we don't have any more events later tonight. And we are having those conversations, and we will be making additional recommendations as appropriate. But let us have today to discuss that further.
Yesterday, Harris County Health announced a fifth case of presumptive positive, and the press release did include flight information for this woman. Why have you not yet released flight information for the
So we released the flight information for a woman who traveled from Italy, from Italy, that we received that information, the positive case yesterday. We have evidence that she had symptoms on the plane, and even though we haven't received the flight manifest from the CDC, we wanted to make sure and inform the community, just as we did with the church. With the other flights, the health authorities all spoke, and at the state level, the national level, the city, or the county, everybody's in agreement that there were not symptoms at that point, and so that's a decision that the health authorities have made. We're, of course, checking on all of the known contacts that those folks have had, and so far we've not received any positives. I'll invite Dr. Shaw also to share his perspective on that.
Thank you, Judge, and thanks for that question. So it was a difficult decision because we recognize as we get information out there, what naturally people start to do is say, oh, I was on a flight, oh, I was on any flight, and then all of a sudden you start to add in information. So as the judge mentioned, one, there was symptoms before the flight, or during the flight, I should say. But in addition to that, we were being told that it was going to be some time before we were going to be able to see the manifest. That delay in being able to get the manifest made us trigger to, as the judge mentioned, to the next level, which was the best way to get this information out in order to at least understand who else may have been. And remember, there were this individual's in first or business class on 2 flights from Florence to Frankfurt, Frankfurt to Houston on March 3rd. We thought it was important to get that information out of really the hope to be able to identify other individuals that may have been in those classes. Now, it's very possible we're going to get that manifest today, tomorrow. But we were told that it was going to be several days, and we did not want to wait to be able to inform the public. And I think that's the most important thing. Now, as far as you mentioned about other flights, it's absolutely what the judge said, that symptoms, but it's also a whole host of other activities that our epidemiologists are involved in. Sometimes it means that we can have a very targeted, focused way of identify the individuals, and that's what our epidemiologists on both health departments, our regional health departments, are very good at doing. In fact, they do it much better than the physicians. Our epidemiologists are very strong at this. However, when they determine that they cannot identify, then that's the point when we may go further with a message to the community.
Mayor, Judge, is there any regret that these containment strategies weren't initiated earlier? I know that you alluded to the fact that there were testing difficulties, that there was probably other cases out there. Should these actions have been taken before?
Let me just answer. I have no regrets because we're basing decision based on the science and the medical advice and the facts that are presented. And let's bear in mind, this is a new phenomenon. We're in new territory. And everyone is making the best judgments around the globe to try to take the necessary steps to keep people safe, to protect everyone, and then at the same time recognizing that people still have to work, they still have to take care of their families and their kids, and they still have to pay the mortgage and the rent and the electricity bills. And so up to the point of yesterday, all of the confirmed cases in Fort Bend, Harris County, and Houston were directly tied to international travel. And with the exception of the Italy example, they were all connected directly to the Egyptian cruise liner. And then please bear in mind, as it relates to the city of Houston, there are only 2 confirmed cases in the city of Houston. I cannot say that enough. Now, that's not to say that there's not community spread. And we are taking steps, regardless of whether community spread was detected in Houston or Harris County or Montgomery County. We're taking steps to contain and mitigate. Okay? And so that's what we're doing. With respect to Sarah Week, which would have attracted thousands of people from 80 different countries, that event was canceled. There are other conferences that have already been rescheduled for later on in the year. So the definitive steps have already taken place. Myra, with respect to the schools, I think what people need to bear in mind, the vulnerable population are seniors with underlying medical conditions. For whatever reason, kids seem to be dealing with this much, 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 much better. So the vulnerable population are seniors. with underlying medical conditions. But let's bear in mind, we are in new territory across the globe, across the country, and we're all taking the reasonable, necessary steps based on the science, based on medical advice that's being presented to us. So, no.
Can Dr. Hurst or Dr. Shaw both talk about, we have a big medical center, like, is there capacity with our beds for how many people we can handle? Are you guys looking at adding additional beds? I understand also, not to just put it all together, but some of the private hospitals like Methodist and HCA and things are working on possibly like having 10.
We'll let Dr. Shaw and Dr. First respond, and then we're going to end the news conference, and they'll be around for other questions.
So I'll start first because I was closer to the microphone, although I was hoping that Dr. Peirce would be able to answer this. In all seriousness, I mean, Dr. Peirce and I cannot thank him enough for his collegiality and partnership, and you all have seen us working around the clock together, and I think it's just a reflection of City of Houston, Mr. Williams' health department, as well as the county health department. All of our team members, our regional health departments, are just really incredibly, we're just fortunate in this region to have strong health departments. I should really say that. What I do want to say is that we have equally recognized that it's very important that we're working with our healthcare providers and our healthcare systems. And so we have been getting messages out, as you know, that our Harris County Public Health operates the regional HAN, the Health Alert Network. We have sent over a dozen messages out to healthcare institutions and entities and healthcare providers to get updated guidance to them. The challenge that we've had, and this has really been a global challenge, that this really goes in phases, and we are hoping that we can, as Dr. Peirce mentioned earlier, delay or bend the curve so that surge is not required within the healthcare entities across our system, not just in Texas Medical Center, but throughout our region and throughout the state and beyond. So what we have been doing is working with those institutions to say, first, plan for surge. Plan for all the different activities that are going to be required, potentially if we got to a point of having additional needs. But we also recognize, and this is not a local phenomenon, this is a national phenomenon, that we simply do not have enough capacity if we were to see a large surge, again, if we were to see a large surge that happens all at one time. Not over time, but all at one time. So it's absolutely critical for us to really work with those hospitals, healthcare entities, ICU beds, hospital beds in general, alternate care site strategies, how are they protecting their healthcare workers, personal protective equipment, how do they assure the supply chain, all the different communications messages to their own teams, but also beyond, and really testing and all the other activities that really go along with it. We recognize the incredible strength of our healthcare partners, and we're certainly working with them. And Dr. Peirce, I know, has some additional information.
Thank you, Dr. Shaw. And I want to point out, this is a great question. It really kind of goes to the crux of what I worry about. And so we have been working closely with the health systems. Bill McKeon from the Texas Medical Center has had several meetings. The mayor has actually basically chaired one of those meetings with us. And we've been talking with all the big hospital systems and some of the independent hospitals that are large hospitals we have talked about. And we have been talking about surge capacity for patients who require hospitalization. We've been talking about surge capacity for the emergency department, and we've been talking about surge capacity for laboratory testing. And so I want to remind everyone that this is Houston, and unfortunately we have weather events that stress our community, not the least of which is the healthcare community. And I would remind you of 2001 with Tropical Storm Allison. We lost 5 hospitals within 3 hours on a Friday night. I, for one, will never forget that. 4 of those hospitals were 4 of the largest in the city, and they were offline for months before they came back online. And we were able to figure it out and surge at that point. Now, Tropical Storm Allison, we had no warning, and we were able to do it. So now we have a warning. We've been coordinating with the health systems, with the hospitals. Plans are in place, and hopefully we won't have to go there. Again, I would direct you to our chart over on the side, as Dr. Shaw pointed out. Our whole goal with all of these strategies is to slow down the spread of the virus throughout the community, hopefully minimize how many people become infected, but even if we are unfortunately able to fail at that, if we can spread it over a longer period of time, then the healthcare community will be able to take care of those patients. There'll be an ICU bed available for the person who needs it. There'll be a regular hospital bed available for the person who needs it. There'll be testing available for the people who need to be tested. And one last thing I'd say before I step away from the podium is with testing, we are increasing our ability to test. We're working with the hospitals, we're working with the commercial industry laboratory testing industry, and that capacity is growing. But an important thing for people to understand is if you are not having symptoms, you do not need to be tested. And this is important to understand. If somebody, when you get infected with a virus, you know, the virus comes into your body and it starts replicating itself. And the amount of virus starts to slowly grow until the point where you start having symptoms. And then depending on, you know, all these factors, how healthy you are, your underlying medical problems, your age, so on and so forth, determines really about how sick you will get. But if you're feeling well, even if you have the virus in you, if you're feeling well and we test you, that test is likely going to come back negative. So all that we've done at that point is wasted a test. So the testing for people who are without symptoms but are simply scared, and I understand that people can be very scared, but if you're not having symptoms, the test does you no good. It may, if you were to get tested, and we're advocating that people who are without symptoms do not get tested, but if you did get tested and it came back and it was negative, that may not be accurate. You may have tested 2 days early. If 2-3 days later you start having fever and difficulty breathing and get tested, then it would come back positive. But getting tested before you have symptoms should not give you any reassurance. So people should not ask for that. Pay attention to your symptoms. When you get symptoms, contact your healthcare provider. And here's another important part. If you have symptoms and you think that you're infected, please call ahead, because our healthcare workers are a vital asset in our community. And we've already seen at some of our hospitals how some of our healthcare workers became exposed to cases, and then they had to quarantine. Well, we can't afford to be losing doctors and nurses to quarantine when had somebody called ahead and say, hey, I'm coming in, this is what I think I have. They then properly met you at the door and escorted you in and took care of you, and the healthcare workers didn't get exposed, and they could have kept at work. So every time somebody just shows up and thinks I have it, when it turns out that they did, those healthcare workers are exposed, and then they got to go home from work. And that, we can't afford that. So please work with us. Again, we've been through this before. When the community does their part and government does its part, we've gotten through this before. We'll get through it again. Thank you.
And lastly, let me just say collaboratively on that note, the city and the healthcare community, we've been working together.
And the county.
I'm sorry.
We're all in these meetings together.
But the point that I wanted to make is that what is important for our healthcare community is PPEs, personal protection equipment. And that's what we're needing. That's what we're needing from the CDC, is personal protection equipment, PPEs. And over this weekend, for example, when the call came in to me from the medical center about when we're getting ready to stand up, for example, alternative testing sites, the need for PPEs. The city's been planning for 6 situations, as well as the county, over years, and we did an inventory of our own equipment that we have. And on Saturday at 3 p.m., we sent over to the medical center 10,000 N95 masks to the medical center. So we're all working collaboratively. The county is inventorying its assets and sharing assets as well. And so all the different units are working together. Let me thank you for being here. Dr. Sharp, representatives from the county. Joel, thank you. Doctor, thank you, from the Houston Livestock Show and Rodeo, all the city council members, department heads, and we're going to keep working, and this too shall pass. Thank you very much. Yeah. Keep forgetting.
You just heard from Mayor Turner, Judge Lena Hidalgo, HLSR President Joel Cowley, multiple doctors about why the difficult decision to cancel the Houston Livestock Show and Rodeo was made. Multiple people called it difficult. Mayor Turner says he does not regret that decision. He says it's effective today. We're going to check in with Chris Costa in a minute, who is live at Energy Park, to get reaction from there. As far as we know, this is the first time Rodeo Houston has been canceled since it started in 1932. Now, the rodeo didn't go on as scheduled in 1937. That was only because the facility, Sam Houston Coliseum, wasn't complete. But as far as we know, it has never been canceled mid-run. This was an event that started on March 3rd. It was slated to run until March 22nd. Here we are on March 11th, less than halfway through. And because of community spread of the coronavirus, city, county, medical, and rodeo officials are saying it is time to cancel the Houston Livestock Show and Rodeo. President Joel Cowley did say that scholarships will be fulfilled. They're also working on a refund process. We're going to have more on that in just a minute. But along with the rodeo, Mayor Turner said that any other city or county sponsored event is going to be canceled. And the reason this is happening, not a couple of days ago when pressure really started after South by Southwest announced that it was being canceled, Mayor Turner says the facts changed. There had been multiple confirmed cases, but they were linked to a cruise ship in Egypt. It was all travel related. Well, that changed, he said, when last night he got the call that there was the first non-travel related case in Montgomery County that indicated that there was community spread. So the goal now, he says, and medical experts added as well, is to contain and mitigate the spread of the coronavirus. So Judge Lina Hidalgo even suggested that there would be more positive tests if more could be done, but she said the county just hasn't gotten enough tests from the federal government to do all that need to be done. And Dr. David Pearce, said the reason this decision was made is to save lives. Because even though about 80% of the cases exhibit mild symptoms, 15% of folks get hospitalized, and there is a 2% mortality rate. So how can you help? Social distance, keeping your distance from folks, not being in large gatherings. Remember, wash your hands. That is the #1 way to prevent coronavirus. Use hand sanitizer when you can. Cover your cough. That social distance, that is why this decision was made to cancel the Houston Livestock Show and Rodeo for the first time since 1932. Chris Costa is there live on the grounds, and we want to check in with him. Chris, what is the response out there among people who are now being told they got to be off the grounds at 4 o'clock?
Yeah, Brandy, you can imagine the disappointment here from all these folks who had been looking forward to many of these events over the next couple of days, especially all those big name concerts that were coming up. And the Houston Rodeo, the Houston Health Department had put out a lot of sort of preventative measures, like these hand washing stations that they had doubled up on, all these extra hand sanitation stations as well, to try to make sure that people who were coming to the rodeo were going to feel safe, clean, healthy, so on and so forth in this large setting. But again, as you mentioned, it all changed when they heard about that case from Montgomery County that involved that man who went to the barbecue cook-off on the 28th. They say they're now working on retracing his steps, and so what they have told us as far as the rodeo organizers, they are planning to still fulfill the scholarships, but again, these grounds are going to be closed tonight at 4 o'clock. So we've been seeing a lot of those school groups starting to leave the area. That's because it's about 1:30, so some of those people are telling us that that's because it's actually time for them to go so they can get back to school, make sure they get them dismissed on time. We did also speak to some agricultural students who are here to show some animals and be part of the some of the exhibitors that are inside. They're telling me now that all the lambs and goats that we're planning on being shown, those are going to be shown today instead of tomorrow, and that all the other animals and exhibitors will not be allowed to show. So that's a very big disappointment for all those people who put that time, that effort, that money into raising and showing those animals at multiple different events. I mean, I spoke to one young man who said this was the Super Bowl of rodeos, as you can understand. So it's a disappointing thing for them. As far as those refunds, those ticket refunds, the rodeo says they're going to be working on that process. As soon as they get something finalized, they're going to post it on their website. Brandy?
Chris, thank you so much. Now, we are working to get answers to some other questions that folks might have. Like you said, the refund process, how is that going to work? These are all details that we're expecting to learn hopefully over the next couple of hours, and we'll share them with you on KHOU.com. We also want to encourage you to download our KHOU 11 news app. We can send you notifications when we get answers to some of those questions. We're also updating you every time new information comes in about coronavirus. New positive test results, new developments, new cancellations. I do also want to mention a lot of you have tuned in you're trying to watch Bold and the Beautiful, that is going to be re-aired tonight, overnight at 3:12 a.m. if you want to set your DVR for that. In the meantime, we will continue working on gathering more information for you. We'll have complete coverage coming up at 4 o'clock on the 411. We'll see you then.